I've decided to dedicate my life to health and health equity because of the many experiences I had, especially that of a child growing up in Ethiopia in the middle of a civil war. And so what I saw happening at the age of 5 through 10 was really a country at war with one another. I saw people dying, I saw people suffering, I saw differences in political perspective throwing families apart. And the one area where I saw people really come together was when it came to the health and well-being of an individual. So when it actually came to a single person suffering or going through pain, I found that we were all able to put aside political differences, national differences, ethnic differences, and come together to make someone feel good and to make someone feel better. So I was about 13 when we moved to the United States, and it was in the middle of the Ethiopian famine. And while in school, in the safety of a suburban neighborhood in the US, we sat as a class to watch the famine in Ethiopia. And as people were listening, some were making jokes, others were really feeling empathy. The one thought that struck me in my head as I saw those young children and the families was, that could be me. There's nothing I did as an individual to deserve to be in this safe, warm space watching a video about them. And so I'm always reminded that when you see people in difficult circumstances or those who are less fortunate than you, of course you work hard, and we all work hard, and there are things that we do to change our lives, but there's so many things that are also just based on luck and fortune. One of the things that my parents taught me at an early age is to practice gratitude and to be grateful for every single thing you have. The one thing that growing up in a civil war, once again, people say, do you think the glass is half full or half empty? And I normally say I think it's half full, but I've even evolved my thinking through the years of that, which is I'm happy because I have a glass and I have some water. I have a lifetime opportunity that I literally thought I would have to retire and go chase after, that it just happens to arrive. Really, our goal is to activate leaders at the top of organizations, partner with local organizations to really make health equity accessible to all, and also to partner with national players to make the ability to take action on equity available to those that may not have the level of resources or investment that we do. The other thing my parents taught me is to know that I can change those things that I don't like, and that things will change regardless of whether I want them to or not. The one thing that you'll find when I look back at my life and when I think about the choices I've made is looking for where there are gaps and how I can actually be a bridge, a glue, a connector to actually solving for the barriers, instead of feeling like, oh my gosh, this is so hard, there's nothing I can do, the system is this way. I've always found that there's no system that can't be changed, and I believe that every single one of us can do something to drive that change.